Dr. Gladys, you come from a prominent political family. Your grandfather served twice as a Prime Minister of Kingdom of Buganda, and both your parents were active in public life. What drew you away from politics and towards becoming a veterinarian?
Yes, very excited to be here in India. Actually, my father, in his political career, came to India and met with Indira Gandhi. There's photographs of that. I don't think I carried it with me, but I'll show you those photos when we get back to the hotel. So my grandfather was the Prime Minister of Buganda Kingdom twice. The first time was for a number of years, and then 29 to 45. Then he took some time off, and then the British government wanted him to come back. He was somebody who believed strongly in education, and so he started off by selling his own land to create a university. It was called the University of East Africa at the time, and it's currently now Makerere University, and he encouraged other people to sell their land. And it even went as far as signing it into parliament. But sadly, tragically, he was assassinated the day after he had signed it. The people who killed him didn't know that he had signed it. But now there's a legacy, and one of the halls in Makerere University is named after him, in Sibira Hall. So my mom grew up in that kind of a situation where her father had done a lot for the country. And then she met my dad, who they met at high school. Budo, King's College Budo is where they met, and eventually got married. And in the first government after independence, my father was very involved in politics leading up to independence. And in the first government after independence, he was appointed by President Obote to become a minister. He ended up becoming one of the most senior ministers who Obote used to send to different countries, including India. He went to India, China, USSR, and all these countries to shop for Uganda. He led delegations as Minister of Works and Housing and Communications. He was also Minister of Commerce and Industry. So he did quite a lot of things. But when Amin overthrew President Idi Amin, before he became president, he overthrew President Obote. And when he became president, he started getting rid of people who he saw as a threat. And because my father came back and lived in Uganda after Obote stayed in exile, my father ended up being one of the very first victims of Idi Amin. He was one of the first prominent people, if not the first, to be killed by Idi Amin. He was abducted from home, and this left a very big dent in the family. We never saw his body. And it took my mom about 2 years to confirm that he had actually died, because those days you don't see the body and everybody denies. They were not allowed to say. But when my mom came out of her grief, she felt that she wanted to continue his dream of a prosperous Uganda, and that's led her to become one of the first female politicians in the country. And so after President Obote, Obote was overthrown. Obote came into power, then he was overthrown. He only stayed in power for a very short time, the second time round. And when Museveni came into power, my mom was among the people who helped to create it used to be called Uganda Patriotic Movement. She actually stood as as a candidate. And then after that, it became National Resistance Movement. And my mom was one of the first ministers, the first members of parliament, female members of parliament in that time. And so I kind of grew up, when I was old enough to understand, I felt that, because I don't remember my dad, I was only 2 years old. When I was old enough to understand, I felt that I wanted to continue his dream of a prosperous Uganda through my passion for animals. I grew up with lots of pets at home, stray dogs like these ones, stray dogs and cats. And my elder brother, who was 10 years older than me, Katerega, used to bring them home. I fell in love with them. And at an early age, I felt like I wanted to become a veterinarian because I didn't like seeing animals suffering. But later on, when actually there was a pet velvet monkey that changed my mind, called Poncho. He belonged to the Cuban ambassador to Uganda, and he used to like coming home, pulling cats and dogs' tails, stealing food from the kitchen. And one time he imitated me playing the piano. And I was like, wow. So not only do his fingers and fingernails look like mine, but he can also play the piano. And that's when I started to become fascinated by primates. I think I was around 8 or 9. But at the age of 12, my mom always, whenever our dogs got sick, I wouldn't go to school. I'd have to go with my mom to the vet first before I go to school.
So you were
And
more interested in caring animal than looking at parents' career, right? So the
I
shadow,
was.
you were more interested in that. So that's what drew you to become a veterinarian, right?
Yes, that led me to become a vet. And also because I felt that the animals didn't have any advocates at the time. There was no one who cared about the animals, and I wanted to care about them, and I knew that it would contribute to developing the country. And then when I started working with wildlife, I realized I could do it at a much bigger scale,
Yeah.
because the animals having been poached, you know, during Idi Amin era, I felt like bringing back the wildlife could
So
help
I
to
have a
restore.
question regarding that.
Okay.
So Uganda's political upheavals from Idi Amin's coup to the civil conflicts
Mhm.
that followed after the Idi Amin fall of Idi Amin affected people and wildlife alike, right? How did this period shape your family's experiences and how it impacted on conservation in the country?
I would say Idi Amin, not only did he kill people, I'm including my father. They say that he killed as many as 300,000 people, although his son says it was 10,000. That's exaggerated. That's still a lot of people. But anyway, Idi Amin killed many people, but he also killed animals
Mm.
because he used to like hunting,
Mm.
and he even tried to hunt in the national parks, which was supposed to be a safe haven for wildlife. So he went into the national parks to try and hunt elephants. Can you imagine? And so under his regime, lots of animals disappeared. And when the Tanzanian soldiers came to overthrow him, thanks to President Nyerere, they also ate animals because they wanted to eat food and they were hungry. And so by the time I was a teenager, I realized that there was very little wildlife remaining. I set up a wildlife club in my high school, Jubilee Secondary School, and we took the students to Queen Elizabeth National Park, named after the Queen of England. And when I got there, I was disappointed that there was very little wildlife in the park. There was only a few elephants, buffalo, and there were no lions or leopards. And so there were no predators at all. And having seen that there were no predators, I felt sad. And I thought, why don't I become a vet who brings back the wildlife? And that made me start to thinking about becoming a wildlife vet.
Yeah.
Mm-hmm.
So early in your career, you worked closely with chimpanzees, right?
Yes.
What experiences or insight that led you to shift long-term focus on gorillas, especially mountain gorillas?
Yeah, early on, I worked closely with chimpanzees because actually chimpanzees were one of the animals which were being trafficked across the border. They were victims of the bushmeat trade. So in neighboring DRC, they would they eat primates. So they would eat the chimpanzees because they believe that if you eat a chimpanzee, you can become as strong as a chimpanzee. And so the babies were too small to eat, and they knew that if they sell them, they can make money because everyone feels sorry for the cute little chimpanzee babies. So they'll sell them and they will end up at the Uganda Wildlife Education Center. That time it was just the Entebbe Zoo, an orphanage. It became an orphanage for animals, especially chimpanzees. And they were being looked after by the Jane Goodall Institute. So I started, during my vet school in London, Royal Veterinary College, University of London, I was able to come home and work with animals of my choice as part of my practicals. And I got a chance to work with the chimpanzees in Entebbe Zoo, which was really amazing. It was my first time to work with what you call exotic animals. And what I learned a lot about these chimps is that they were very mischievous. They're about the age of 2 to 3 years old, but they used to like escaping from the cages when you're not looking, run around the zoo. Then they wanted to be carried, to be brought back in because they missed the hugs of their mothers. And I realized how devastating the bushmeat trade could be, but also how intelligent they were. And then later I got a chance to work with chimpanzees in Budongo Forest under Professor Vernon Reynolds, who I met when he gave a talk on chimpanzees in Budongo Forest at London Zoo, when I was going to show pictures of the chimps in the cages to Ian Redmond, who was one of the first people to work with the late Dr. Diane Fossey. And so he invited me over to Budongo. And that was really exciting for me. So a year later, I worked with wild chimpanzees, collecting samples from collecting fecal samples from them. They'll drop from the night nest up in the tree, and I was looking at parasites in the chimpanzees, which was very exciting. Actually, my mom came to visit me there, and we got up early in the morning to look for chimps, and then later. But the thing is, I'd always wanted to work with gorillas because when I was setting up the wildlife club, a warden came in to the offices where I was volunteering, and said there are mountain gorillas in Uganda, and I was like, wow. So he was very, very excited because they had just discovered when they saw night nests in Bwindi forest. They took samples of the poo, the fecal sample, sent it to America, and it was exactly the same DNA as the ones in the Virunga. And so they concluded that Uganda now has mountain gorillas. So I wanted to see them. I said, oh, I want to see them. He said, no, they're not habituated. It takes a number of years to habituate gorillas. And so I always had it in my mind. And so when I met Professor Vernon Reynolds, I told him, I want to go and work with the mountain gorillas in Rwanda or Uganda, because some vets had come to the vet school and given a talk about their work with gorillas in Rwanda. However, because Uganda and Rwanda were fighting, there was no way that I could go to Rwanda. War. And so I ended up, Professor Vernon said, you can come to my place. So I studied chimps. Then 2 years later, the gorillas in Uganda were habituated, and I could now study the gorillas. And so I was able, through a vet called Dr. Liz McPhee, who had been working in Rwanda with the mountain gorillas as a vet, was setting up international gorilla conservation program in Uganda, and she contacted me. Someone asked her to contact me, and that's how I ended up working with them. And the director of the national parks, Dr. Idroma, I had to write to him. My mom also went to his office, and he was like, okay, you can go and do some research with the mountain gorillas. Now they're habituated.
You have spent decades observing mountain gorillas. In what key ways do they differ from the lowland gorillas in behavior?
Yes, and actually it's still part of that question. The reason why I decided to focus on gorillas and not chimpanzees is because when I got to Bwindi forest, there were very few gorillas, and I was very concerned that they're going to become extinct. Because when I got there, first of all, you get there and suddenly they tell you the gorillas are in that forest. It's human habitation right up to the edge of the park. There's no buffer zone around most of Bwindi, which really struck me. It's a very hard edge. And when I started to work with them, of course, me being a vet, I realized that we could easily make them sick because we got so close to them, 5 meters, and they were very accommodating and they didn't go away. They didn't run away. They were just very relaxed. And actually, when I arrived, I had a bad cold, so I had to first get better. And it made me realize that they're very vulnerable to human disease and the loss of their forest home. And I wanted to just focus on the mountain gorillas. I wrote to Professor Idroma and I said, I want to be your first vet. This is what vets do for wildlife. And he gave me the job. So I created a job for myself.
Yeah. So how they differ from the other gorillas, lowland gorillas?
The
Is
mountain
there
gorillas,
any behavior difference?
the main way that yes, there's also some behavior changes. But the way that they look is different because mountain gorillas have more hair because they live in a higher altitude. So they need thicker hair in order to survive. And that's one of the biggest differences between them. Mountain gorillas eat more leaves, shoots, and stems, not as much fruits, whereas lowland gorillas eat more fruit because in their habitat, it's more lowland and there's more fruit trees for them to eat. The way that they differ in behavior is that mountain gorillas tend to live in a harem where you have silverback with many females and babies. You may have a couple of silverbacks, but it's more like the family group is more like a harem. And they kind of move together in those families. And if there's any transfer between families, it's when males are fighting for females and the females decide to transfer, or females just go for different reasons. And so that's kind of how they move. And you track gorillas by following the gorilla family, and then you get attached to those different family groups. And they have a very close sense of family, which is amazing. So with the lowland gorillas...
Generally in gorilla clan, or it is lowland and highland, family bonding is different?
Family bonding is a bit different. In lowland gorillas, they tend to live in the wild. They tend to live in... they can live in communities, a bit like chimps. They can live in big communities and they can have fission and fusion. So they come together where they're feeding from. They call them bais in West Africa, where they're feeding from. So they come together and then afterwards they separate and then they come together. So they don't have as strong, close family groups in some areas of the lowland gorillas. So that's why it's harder to habituate lowland gorillas than mountain gorillas. Because it's easier to habituate them when they're in a family because they have each other for security, and so you get to know them. But with the lowlands, you may see them and then the next time they're separated from the family, then they come together. So it's not as easy to habituate the lowland, the western lowland gorillas. But the eastern lowland gorillas are similar to the mountain gorillas. They are only found in DRC. They're called eastern lowland because they're at a lower altitude than mountain, but it's still quite high altitude, and they also move in family groups.
Your work has been influenced also by Jane Goodall's examples.
Yes.
How did your association with her begin, and how has our work with chimpanzees shaped your work with mountain gorillas?
Yes, like my work has been influenced by Dr. Jane Goodall. I got to know about her when I was at vet school in London. They put up a sign that somebody was talking about chimpanzees in Africa, and I got excited, of course, because I'm from Africa, and Tanzania is just next to Uganda. So I went over to the talk. I convinced my older sister, Veronica, to come with me. She was doing an MBA at London Business School. So we went over and met Dr. Jane Goodall. Her talk was amazing. I was very fascinated by how she had a very close bond with the chimpanzees. I knew them by name and really studied their family groups. So at the end of the talk, when people were lining up to buy her books, I went up to her and I said hello to her and I bought her book. And she smiled because me and my sister were the only Africans in the room. This is London in the 1990s, early 1990s, 1993. And she invited us to Gombe National Park. I must admit, I haven't yet gone because it's not easy to get to Gombe, but I plan to go to pay homage to her because it's, sadly she passed away in October.
So you haven't visited Gombe at all?
I've not visited Gombe.
Okay.
But I met her several times in Uganda. Because she's, on top of setting up the Jane Goodall Institute, like looking after the chimpanzees, where I worked as a vet student, she also did a lot of projects. The Ngamba Chimpanzee Island, she set up the first chimpanzee sanctuary, and I was involved in translocating chimpanzees there, and I used to look after them there. The chimp there named after me called Kalema, because I rescued him. He's one of the males, the big males, handsome, one of the most handsome. And then also she comes to Uganda often, and the Jane Goodall Institute is now a big organization in Uganda. I trained some of the first vets they had, Dr. Peter Appel, Dr. Richard Suna. They were the two first vets they had. And so through her work in Uganda and through all the different primate circles, I got to know her. So I was very honored and excited when she accepted to write the foreword for my book. And she did write a fantastic foreword for my book. And because she wrote it like someone who knew me, because she's been watching my career over the years. Yeah.
The One Health approach is central to your work at CTPH.
Yes.
How do you explain this approach to communities on the ground, and when did you first realize that human, wildlife, and environment health had to be addressed together?
Yes, the One Health approach is something that we championed at CTPH. One of the first cases I had to deal with at Bwindi as Uganda's first wildlife vet, they called me and told me that the gorillas are losing hair and developing white scaly skin. So it's just 9 months into the job. So I called a human doctor friend of mine. Actually, I went to her office and I told her that I'm not sick, but I've come to find out how you can advise me to handle this case, because it's a 10-hour drive to Bwindi. You want to make sure you go with all the drugs and everything after that very long journey. And she told me that I said, what is the most common skin disease in people? She told me it's scabies. And I was surprised because where I did my training in UK, people never got scabies. It's a disease of people of poverty and inadequate hygiene. And she said, yes, it's common because of low-income groups of people in Uganda have scabies. So luckily, scabies can be treated easily. So I bought ivermectin to travel with me on the long journey. When we got there, we found that the gorillas were scratching, and it really looked like scabies. And I was with a vet from Kenya, Dr. Richard Koch. He helped set up the Kenya Wildlife Service Vet Unit, and he had seen sarcoptic mange scabies in cheetahs in Masai Mara. visited by very many tour vehicles. Those cheetahs had more scabies, and those that were not visited didn't. And he attributed it to stress. And so when we went into to the group, we darted we were able to dart we couldn't dart, all of them were affected, but we couldn't dart the baby that was very, very sick, had lost almost all its hair, because the mother was very shy and she kept hiding from us. So we darted the juvenile, the 6-year-old, and he was scratching even under the effects of anesthetic, ketamine anesthetic. We took samples from him, and he went, and gave him an injection of ivermectin because we assumed it's scabies. And when later, the next day, the mother dropped the baby when we were going back to try and get hold of the baby. She dropped the baby. Normally, gorilla mothers can hold on to their baby for a long time because they're mourning. And so by the time they drop the baby, it's decomposed. But she was so fed up with this baby that had been sick for so long, just dropped it. And so we're able to get a fresh post-mortem from that baby gorilla. And the mites were still alive when the baby had died. And so from that, we're able to confirm that it's scabies. And a few years later, there was another scabies outbreak in another gorilla group that was being habituated for tourism and spending a lot of time outside the park. And the reason why these gorillas picked up scabies is it's a very hard edge, as I mentioned. And once they're habituated for tourism, they lose their fear of people and they start to range in areas where they used to range before their forest home was cut. And so, and it's easier to habituate gorillas at the edge of the park because you want people to go and come back on the same day, tourists, researchers. And so we're finding that frequent problem that habituated gorillas, there's more human-wildlife conflict. They go outside to eat people's banana plants because they have wild plants in the forest and they eat people's banana plants. And when they get in to eat the banana plants, people put out scarecrows to chase away wildlife, to protect their crops. And so it's baboons, gorillas, birds, and other wildlife. And so that's how they picked up the scabies. They touched dirty clothing on a scarecrow because it's such a high incidence of scabies in the local communities. And so it made me realize that you couldn't protect the gorillas properly, keep them healthy, without improving the health of their human neighbors. And that's a few years later, we founded conservation through public health.
The Gorilla Conservation Coffee is one of the CTPH's most recognized community initiatives. How did this idea take shape and how does it strengthen both local livelihoods and the long-term gorilla conservation?
Yeah, Gorilla Conservation Coffee is an idea that we came up with and founded it in 2015. CTPH is 23 years old, actually, this year. 22 years old. It's about to be 23 years old. And Gorilla Conservation Coffee began 10 years ago. We found out that many people are unhealthy because they're poor. As we're improving community health and finding that as people are improving, their health is improving, gorillas are falling sick less often from diseases in the local community. We also found out that people are unhealthy because they're poor, and poor health is another dimension of poverty. And the coffee farmers bordering the park were not all part of the tourism industry. Gorilla tourism transformed the communities and lifted them out of poverty. Former poachers became rangers. We call them born-again poachers. They now had jobs in the Wildlife Authority and in the lodges and NGOs like ours, the Bwindi Community Hospital. But also at the same time, they also could sell crafts, food, accommodation, but not all of them were part of this industry. And people are still entering the forest to poach and collect firewood because they didn't have a viable livelihood. And so some of them were coffee farmers. So when you're visiting the gorillas, you often cross coffee farms. They even stop and tell tourists, this is a coffee tree. And many of them are excited to see it because they've only seen coffee in a supermarket or in a cafe. And I found out later that these farmers were not getting, or these coffee growers were not getting a fair market or steady price, and they were still entering the forest to poach. So my husband suggested to me, why don't we create a global coffee brand to save gorillas through coffee? Because he lived abroad for most of his life, and he knew that people love drinking coffee all over the world. Ugandans don't drink a lot of coffee, by the way. We export the most coffee in Africa, but we don't drink it. But around the world, people love coffee. And so we thought, why don't we create a global coffee brand? And we decided to call it Gorilla Conservation Coffee, where we give the farmers a good price for the good coffee. Fortunately, it's a high altitude. So this coffee is actually specialty coffee, premium specialty. And a donation from every bag sold goes to support the work of conservation through public health, to improve gorilla health, community health, and conservation education in the same communities.
So how is it doing? How is the coffee doing?
The coffee, it's grown.
Ah.
It's doing quite well. The problem is it hasn't yet broken even. The reason why is it's very hard to have a business that is not only looking at profits but improving community well-being and helping gorillas. So achieving the triple bottom line. You know, it's very hard to, because that costs money to do the social part and the environmental part. But we started off with 75 farmers, of which 5 were women. And now we have 630 farmers we're engaging, of which 230 are women, which we're very excited about. And the women farmers are actually better than the men farmers because they pay more attention to detail. And we're not able to buy coffee from all of them, maybe only 1/3 of them, because we can only buy what we sell. When we started the company as a for-profit social enterprise of conservation through public health, we got support from World Wildlife Fund Switzerland in the Impact Investment for Conservation program. So they became the first investors with a convertible loan. And when we started the Gorilla Conservation Coffee, we expected to, I was losing my chain of thought. We expected it to become profitable quite quickly, but it took a while. So they gave us a loan, and that money from the loan helped us to set everything up. But in the end now, the only money that we're using to buy coffee from farmers is from what we sell. And if you don't have that working capital, you know.
But how it is received as in the coffee connoisseurs? This the coffee tea, is it a very distinctive from other coffee varieties?
Yes, it is.
Okay.
It's distinctive because it's single source.
Okay.
It tastes very good. That's why we keep getting repeat customers. It's traceable. We can tell you where the coffee came from. So we're catering to conscious consumers, people who want to do good, who want to only drink coffee with a cause. In fact, we call them lifestyle of health and sustainability consumers. Those are the kind of people we are. And the tourists who come and like that, the time they make it all the way to Uganda, all the way up the mountain to see gorillas, they actually care about wildlife. We get that kind of tourists, eco-tourists. We also get many expatriates. Ugandans are now becoming coffee drinkers because we have a gorilla conservation cafe in Entebbe, close to the airport. When you land, you can go there and learn about our work, learn about the gorillas, and drink coffee from people bordering the park. So just by drinking that coffee, you're also contributing to conservation. So we get a lot of tourists who come through. The tour operators bring them there. Plus, a lot of Ugandans are really getting into drinking coffee because our baristas teach them what a latte is, a cappuccino, and then they start to like drinking their own coffee.
Oh, nice.
And so it's doing really well. It earned 92 points in Coffee Review in California. It was among the top 30 coffees they reviewed in 2018. Number 29 out of 30. We're very excited. And now we're trying to get all the farmers to produce that good coffee because they can. It's a high enough altitude, but we do a lot of farmer training to make sure they harvest it in the right way, they process it properly, and then we give them a good price for good coffee. So we have agronomists on our team. We work closely with the Uganda Coffee Development Authority, which sadly has just been dissolved. It's now part of Ministry of Agriculture. And sadly, their executive director passed on last week, which is very sad. And he really marketed that. He loved our coffee because whenever we talk about it, it would show that Uganda has good coffee, you know, because you can only find gorillas in Uganda. So it helped with marketing Uganda coffee abroad. We joined efforts in that. We also work closely with New Cafe, who he's also an Ashoka fellow like me, and he helps us in training our farmers and roasting the coffee at his place, and Africa Coffee Academy and other groups. So and it helps the Uganda Wildlife Authority because we're improving the relationship between the community and the park. Because when we engage the community in meaningful activities like coffee growing, by giving them a good price for good coffee, then it means there are less poachers in the forest. And it contributes to the general efforts of conservation.
Yes.
And the fact that a donation is put aside to support the same communities, it's also very good.
So zoonotic diseases are often linked to the human-wildlife interaction, right?
Yes.
When you interact more, then it is alleged that more zoonotic diseases are either goes from this side or comes from that side.
Yeah,
The diseases, particularly after the COVID, it is people see every human-animal interaction with the suspicious, and tourism is also sometimes viewed with suspicion because your interaction is happening when you go into wildlife tourism. How do you see this issue as a veterinarian, as a vet? How do you see this?
yeah. Human wildlife conflict is a big issue. As I mentioned, habitat loss is a big
No,
contributor.
I'm talking in terms of
Zoonotic
diseases.
disease, yes.
Yeah.
The habitat loss leads to the human wildlife conflict. And because we're so closely related to gorillas, chimpanzees, we can easily make each other sick. And that's how disease jumps back and forth between people and animals. And so human wildlife conflict leads to zoonotic disease transmission. Also, another form of human wildlife interaction is when people come to visit the gorillas. Um, they can easily make them sick by coughing on them. They can give them flu, and that's actually why Dr. Droma was convinced to hire me as a first vet, because tourism had begun, and he was concerned that they could bring a fatal flu such as COVID-19. So during the pandemic, people really understood our One Health approach to conservation. We actually got some donors because of it, because some of the donors were like, we talked to them about zoonotic disease, and they're like, is it so important for conservation? And why are you really focusing on this? But when the pandemic happened, they realized actually diseases jump back and forth. And if you don't address zoonotic disease, you can't really keep the wildlife healthy and their habitat secure. So it's a thing that affects both the people and the wildlife, and you really need to address zoonotic disease transmission. And so we look at it in both directions, jumping from people to animals, and also jumping from animals to people. We try and discourage people from eating bushmeat because it can make them sick. We've also prevented tuberculosis between people, wildlife, and livestock, because some people eat cows that have grazed with buffalo that gave them TB, or they approach animals like buffaloes and get TB. Anthrax is another big issue. People have died by eating hippos that have died of anthrax in Queen Elizabeth National Park, for example. And so we try and prevent that. Of course, Ebola is a big one in Central Africa, Congo, Brazzaville, and other countries. Gorillas died of Ebola, and people died who ate these gorillas that died of Ebola. And so it's not that gorilla wasn't the source of Ebola, that's why they died. You're thinking maybe it's some kind of bat in the forest, but it hasn't been proven yet. And so we're trying to prevent disease transmission in both directions and cautioning people about eating meat from unknown sources. Like we don't know where COVID came from, but the most likely cause is it came from the market where it was first seen, the Wuhan wet life market in China. That's the most likely cause of where it came from. Still trying to get evidence that's probably connected to the disease jumping from people to animals. And so we know for sure that diseases definitely jumped from animals back to people, like farmed mink and things like that. And so COVID was jumping back and forth between people and animals. And so the pandemic showed us that if you don't address zoonotic disease, you'll have a big issue, not only for people, animals, and humanity at large. And that's, it can even result into a global pandemic. So it brought up lots of issues about animal welfare. Like if you have markets where animals are in tiny cages, virus can spread very quickly, and then it can even jump to humans, and that can be a big issue. And also, we try and discourage people from living with their animals in their homes, because they can also pick up diseases from each other.
So COVID-19 and Ebola, you answered a question, but still
Yes.
I'm asking. COVID-19 and Ebola raise serious concern for the gorilla in Bwindi, right?
Yes.
How vulnerable are great apes for such outbreaks, and what measures proved most effective in protecting them?
So COVID-19, what did you say? Repeat again?
See, COVID-19 and Ebola raise serious concerns for the gorillas of Bwindi.
Yes.
So, how vulnerable are these great apes for these diseases? What measures effectively played a role in preventing that when this pandemic came?
Yeah. It's because we are so closely related to the great apes, we can easily make each other sick. We share over 98% genetic material with gorillas and chimpanzees. 98.4 with gorillas, 98.8 with chimpanzees. Orangutans is 97%. So it's very high for all the great apes. And we can easily make each other sick. And so what we did is we developed a system where we address the health of the people, the animals, and the environment together. So we have regular gorilla health monitoring to make sure they're not picking up diseases from people or livestock when they range outside the park. And we set up a field laboratory. We call it a Gorilla Health and Community Conservation Center. At this center, community members also come and learn about conservation and how to prevent zoonotic disease. Then we also train, we work with a team of local volunteers. In Uganda, they're called village health teams. We call them village health and conservation teams. They're actually community health workers. We train to do conservation work. We currently have 430 that we're engaging. They're able to visit people in their homes and talk to them about good health and hygiene practices, having hand washing stations outside the toilet, having a proper toilet. We talk to them about having a food crop garden so they don't have to enter the forest to poach. Importance of having a cash crop or some form of alternative livelihood. We talk to them about planting trees, not eating bushmeat because you can make them sick. And we also promote family planning because when we started out, people having as many as 10 children per family, and that's too big. They can't look after them. They can't give them proper health care. They'll tell you that we have 10 children, half are for going to school, other half are for chasing wildlife from the garden. So those that chase wildlife from the garden don't have a future. They end up never getting a job. They end up having teenage pregnancies, and you can't break the poverty cycle. And so we started family planning. Actually, USAID gave us the first funding for that. Sadly, that they've shut down. But it was called PHE, Integrated Population Health Environment. So we've been promoting community-based family planning around the park. And through these VHCTs, they're reaching 10,000 households with over 50,000 people. They're changing behavior. And we're finding that the households over time are coming from not having majority of the indicators that we're looking at to majority having them. So we moved from 20%, 23% green to 63% green in the space of 2 to 3 years. This particular approach of measuring how a community home is improving, we got support from National Geographic Society. I'm a National Geographic explorer. I'm happy I'll be speaking there tomorrow. And we're really seeing that it's a very good way of changing behavior because they're being applauded from what they're doing. And then they're more likely to change because our volunteers have data books and they show now you're in red. The next day they go, you need to become orange, because red households are 4 out of 12 indicators, orange are 8 out of 12, and green are 9 out of 12. 8 out of 12 and above, and below, like that. So if you have less than 4, you're red. Between 4 and 8, 4 and 9, you're green, you're orange. Over 9, you're green. So they're happy when they see themselves moving from red to orange to green. So we're carrying out real behavior change. And over time, we want to show that as the whole community health and well-being is improving through these model households, there's less poaching, there's less zoonotic disease transmission. And we want it to spread all over Bwindi, in all the parishes bordering the park, and also to other places around Uganda. We're actually doing work with other partners in other places, and we'd love to spread the model household approach also to other countries in Africa that have gorillas and great apes.
Wow.
Mm-hmm.
So many countries, including India, struggle with human-wildlife conflict.
Yes.
Sometimes leading to the relocation of communities who are living adjacent or inside the forest area, or attacks on animals. Sometimes people attack an animal, they stone them or burn them and all that.
Yes.
So, based on your work in Bwindi, what practical steps you can help people and wildlife to coexist more peacefully?
Human-wildlife conflict is a big issue, and it really undermines conservation efforts. I have this photograph, I use it often, but when I realized as a young veterinarian, the first vet for the Wildlife Authority, that it's really a big issue is when we carried out the health education workshops, and one of the most popular tourist gorilla groups, Mumbai, had just raided somebody's crops. And we went to his home, and I said, do you think gorillas are important? And he said, yes, because my children have a job. My children are employed by the park, and some of the money from tourism is shared with the local communities. So 20% of the park entry fee and $5 from every permit. Now it's actually 10. Is shared with the local community, but the individual person like me whose crop is destroyed, I'm not being compensated. So it really undermines conservation efforts. And this is something I know in India, like tigers are eating people's goats and cows, even sometimes harming people. We have that issue with lions in Uganda. And so there's a lot of lion poisoning, unfortunately, in Queen Elizabeth National Park. It's a big issue with lions. And so that human wildlife conflict is always going to be undermine these efforts. But what we do is we find indirect ways to get communities to coexist with wildlife. We found out that by addressing their health, we're reducing the money they have to spend on looking for health services for their families. So we're helping to address an issue that makes them poor, having poor health. And we also found that health is another dimension of poverty. And when you improve their health, you make them know that you also care about them and not just the wildlife and the forest.
Okay.
So it makes them care more about the wildlife. On top of preventing and reducing the risk of zoonotic disease transmission, it also makes people feel that you care more about them. And so that's kind of how we have addressed it, but by also improving their livelihoods through gorilla conservation coffee and ready to grow gardens, something we started during the pandemic when a certain gorilla was killed by a hungry bushmeat poacher, when there was no tourism at all. Rafiki, who was a friendly gorilla heading Nkuringo gorilla group in southern sector. When Rafiki was killed, we realized that there are going to be other gorillas going to be killed because people are really hungry. So we started Ready to Grow, where we provide them with 10 types of fast-growing seedlings, food crops that can grow within 1 to 4 months. So then they're able to eat and they don't have to enter the forest to poach. Because they told us that the main reason people are poaching because they're hungry. And so this is something we've continued beyond the pandemic, along with mask wearing. During the pandemic, we promoted mask wearing. And I know you talked about the issue of tourism. Is it a necessary evil? I think it is. And I actually have a chapter of it in Walking with Gorillas, my book, because it's one of the greatest opportunities for conservation, one of the greatest threats to conservation. Because the money from tourism provides jobs and makes people coexist with the wildlife. But at the same time, tourists get so close to the great apes, to the gorillas and the chimpanzees, and they can easily make them sick. So during the pandemic, we made sure that everybody starts to wear masks. We advocated to the government, and it became the new norm. The rangers, anyone who goes near the gorillas, the rangers, the vets, the researchers, the tourists especially, have to wear masks.
Even today?
Yes. It's continued beyond the pandemic. And it's continued beyond the pandemic because we found that there are lots of strains which keep coming up, mixture of COVID with flu, but also during the pandemic in Rwanda, they found that in the Virunga National Park, in the Virungas, in Volcano National Park, they found that gorillas got less flu, less respiratory disease because people are wearing masks. And it's generally a good practice. And it's something we had wanted to advocate before the pandemic, but the pandemic pushed the issue. And so now all the tourists know that if you want to get close to a gorilla, you have to put on a mask, so that you're protecting the gorillas from, getting sick. And now everybody understands it. And because of this, the gorillas didn't get COVID during the pandemic, because in March 2020, as the pandemic reached Uganda, we made sure that everybody wears masks. And even when they go into people's gardens, the gorilla guardians, who are a group of people we've trained to herd gorillas back when they come outside the park, are also putting on masks. They've also been, and they have to herd them properly, putting on masks. And also we're discouraging open defecation. COVID also exists in fecal material. And during the pandemic, we really really increased that whole hygiene, hand washing, all those kind of things. And we also helped to set up COVID task forces, village COVID task forces. Conservation through public health was on the Ministry of Health village COVID task force, which was something that they asked NGOs working with gorillas, working all over Uganda, to set them up. Because when the Delta variant reached there, I know India was one of the first places where the Delta variant was. People were dying very quickly. You also go to Uganda, and they were concerned that people are going to die and it's going to spill over also to the gorillas. We were concerned about that. But they wanted to stop it spreading amongst people, because the government had run out of ICU beds and oxygen. So they tasked NGOs working all over Uganda to develop these task forces. So we developed 59 village COVID task forces in 59 villages. And this really prevented mild cases becoming severe cases that needed to be hospitalized. And that could spill over to the gorillas.
So basically, you say that economy and health can kind of help people to understand why they have to coexist with wildlife.
Yes.
Correct?
Yeah.
Okay. Women like you and Jane Goodall and Diane Fossey have transformed global understanding of great apes.
Yes.
So, how do you see your role is encouraging more women to come into conservation, especially in Africa and Asia?
Primatology and especially great ape conservation is something that has been championed by women. They're patient. There's also Burita Gaudikas who's worked with orangutans in Indonesia. In fact, there were the three primates of Professor Louis Leakey. Actually had daughters, his granddaughter is on our team, Mary Leakey. I would say that when I first started working with the mountain gorillas, there were no female rangers. I was one of the only women who'd actually go in the field. There were wardens or people working in offices, but not out in the field, in the bush with the wildlife. People would look at me strangely, but they accepted me because I brought a unique skill to the table. And, when an animal fell sick, I was the only one who could treat it. So they respected me because of that. But I was changing the mindset of women. And now many women thought, oh, I can also do this. And also the government authorities are like, women can do this. If Dr. Gladys was out in the field treating animals, walking long distances to look for gorillas, moving elephants, giraffes, all those things, I think it's okay to have female rangers. So I think I hope to change that perception in my country, that women can also be out in the field and be very impactful with wildlife. It's not, people are concerned about physical exertion, but women can also walk up those hills and do these things. And so, which are daring and dangerous. And so now 20% of the rangers are women. The aim is to have many more women rangers. Actually, we were remembering Dr. Jane Goodall last week. Actually, it was a Monday last week. And as a legacy, her Green Hope legacy. And I was asked to be one of the panel discussants as people who knew her well. And I did say that, she inspired many women to get involved in conservation and primatology in particular, because she went out and did this at a young age. And I'm glad to have inspired many women in Uganda to also do it. There was a young woman who was on the panel, I would say 11 years old, young girl. She is really dynamic. She started an organization called 1 Million Trees. And she said that she was inspired by three women, Professor Wangari Maathai, Dr. Gladys, and Dr. Jane Goodall. So I was like, whoa, And so we want many more young women to be inspired to get into the field of conservation. And it's not just a field for men, but women can be very impactful. And women can also lead conservation efforts. As the first wildlife vet in Uganda, they often refer to me as Uganda's first female wildlife vet. I'm like, no, as the first wildlife vet. I just happen to be female. So my husband is always correcting them. Because he's like, no, you were the first who started this, and now there's many. We have about 15 wildlife vets who are part-time to full-time. Majority are men, because, it's still a male-dominated field, but I'm glad that there are some women wildlife vets. And on our team, we have a woman wildlife vet, Dr. Gloria Duku, and other female wildlife vets are mentoring within the Wildlife Authority or as interns or volunteers.
Okay. You have worked more than 2 decades with gorillas. Which mountain gorilla character is favorite to you, and why?
I would say that through my years of working with the gorillas, I've become attached to so many of them. But my most favorite was Kanyonyi. And we actually named our first coffee brand after him. When you go to the hotel, I'll get you one bag of coffee. And Kanyonyi is a gorilla that was born in 1996, when I was first hired as the first vet for the Uganda Wildlife Authority. So I grew up seeing how gorillas change and how they change with tourism and how they learn to interact with people. Because he grew up seeing tourists. When we first used to treat gorillas in Bwindi, they were very difficult to approach because tourism had just beginning. I'd been to Rwanda and got involved in the removing snares from gorillas. That's where I got my first training. And the Rwanda gorillas they could get really close to you. They were so relaxed. And we always used to wonder why Uganda gorillas are not relaxed. But now you can get really close to Uganda gorillas because now it's been over 20 years, 30 years, in fact, of gorilla tourism. So Kanyonyi, he grew up seeing tourists. I operated on his older sister when she had a rectal prolapse. And they used to call her Kahara because they said the good girl who likes looking after her younger siblings because she used to like babysitting him a lot. She recovered from the prolapse, which was very good. And she left the group and went on to have other babies somewhere else. But she went to a wild group, so we're not able to keep monitoring her. But by the time Kanyonyi became big and his father, Ruhendeza, died, his father was the silverback of the first gorilla group that was habituated for tourism. I used to write about Ruhendeza in my book. And so when Ruhendeza died, Kanyonyi took over the group. And because he was so used to seeing tourists as a child, as a young infant, he used to frighten them to see their reaction. He was a very playful silverback. So sadly, Kanyonyi died not because of human disease. It was because of natural things in the forest. He fell off a tree and got an infection in his hip joint. And then he got into a fight with another silverback that wanted to take over the group, Mariah, which is no more in gorillas. And he never recovered in spite of treatment. And so when he died, sadly, I wrote a tribute on Facebook, and we had over 300 shares of people who are all, showing photos of themselves and Kanyonyi. And we named the first coffee brand after him before he had died, because he wanted that when people come to Bwindi, they can actually see the gorilla whose coffee is named after. Sadly, he died shortly after we developed that brand, a year after. But still, we continued to keep that name as a legacy of Kanyonyi and other gorillas in the forest.